welcome. You're watching Beat Diabetes, Myths and Facts. I'm Rishika Barua. COVID-19 has shaken up the world in more ways than one. While COVID has given rise to new challenges and uncertainties, the pandemic has also yielded in some valuable lessons. What we eat, our exercise habits, general hand washing, hygiene awareness have all garnered a greater focus. While dealing with COVID-19, we overlooked the fact that people's lifestyles too were severely disrupted. As a result, there are now metabolic problems that have become more common. Unhealthy eating habits, the lack of physical activity and the mental toll of a quarantine and isolation, and even the fear of contracting the virus in healthcare settings have all adversely impacted people with diabetes and heart disease. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetes epidemic and heart diseases. Beat Diabetes, Myths and Facts will impact and help a large number of people to prevent or control metabolic disorders. Today, we have with us experts to share with you advice on how you can lead a better and healthy life. It's a pleasure to introduce Dr. Shubham Jain, MD Medicine, Dr. Shubham Jain's clinic. He's a consultant diabetologist joining us from Agra. We also have Dr. Syed Mohamed Buhari, he's MD Medicine, MRCEM UK, consultant physician, Sri Kumaran Hospital, joining us from Tirupur. Thank you, doctors, very much for being with us. Dr. Syed, if I can begin by asking you, the self-management of diabetes can be, it can be a challenging process. How important is it, for people to have the right kind of nutrition in the management of diabetes?
Yeah, so diabetes itself is a nutritional disease. So when we deal with diabetes, basically the type 2 diabetes, which most of the adults get, so where the intake of our carbohydrates really matters. So it raises the glucose levels, and the problem is that the insulin which is produced in the body is not able to reduce the glucose due to some resistance matters. So self-monitoring of blood glucose is a very important thing, and the need to reduce your carbohydrates in diet also plays a very important role, because it reduces the load for your body, thereby you get better sugar control.
All right. Dr. Jain, if I can ask you, at the moment, it is of course extremely, challenging to be able to manage diabetes and heart diseases at this time. Now, we've read a lot about antioxidants, for instance. How do antioxidants promote good heart health, and what are some of the foods that have the highest amount of antioxidants?
So basically, antioxidants are substances that prevent damage to the cells caused by the free radicals. So what are free radicals? Free radicals are basically a waste kind of materials which are produced in our body due to damage of the cells or due to other activities which happens in our body. And a diet rich in antioxidants can help us preventing many diseases, including heart disease as well. So what are the good sources of antioxidants? They are basically vitamin A, vitamin C, vitamin E, beta carotene. These all are good sources of antioxidants. And if antioxidants are less in our body, so in patients with heart related diseases, there will be accumulation of bad cholesterol, which is the low density lipoproteins or LDL cholesterol. And that will lead to accumulation of cholesterol into the blood vessels and can worsen the heart disease as well. So food items which contains the highest amount of antioxidants are basically broccoli, spinach, carrots and other fruits, and even dark chocolates contains a good amount of antioxidants in them as well.
All right. Dr. Syed, when it comes to diabetes, it's all about regularly monitoring your blood sugar and controlling it. Now, following a strict diabetes appropriate diet means eliminating sugar totally from one's regular daily diet. Is that what you recommend, completely eliminating sugar of all kinds?
Actually, that's a more misunderstood fact, I believe. Actually, reducing carbs totally from the diet That too in our country, particularly the Asian countries as a whole, is almost impossible, and it is not the right thing. Actually, our cells to function well, glucose is the major fuel. So reducing glucose altogether from the diet is impossible, and it is actually deleterious to the body. So we should supply the right amount of carbs, that is most important, and we should learn how to make the body utilize them well. So the basic problem in diabetes is underutilization of the glucose. So that is where we have to work upon. So totally avoiding the sugar or carbohydrates in the diet is not advised. We can take, it is the quantity and quality. So how we choose to take the carbs, what amount of carbs we intake, and how we actually work, make the workouts and actually makes the body utilize these carbs in the diet is most important.
All right. Dr. Jain, what about fruits? They are considered to be a part of a healthy diet. But for people with diabetes, some fruits can actually lead to an increased levels of blood sugar as well. So which fruits are safe to be consumed by people who suffer from diabetes? And what about fruit juices? Are they equally safe? And, what is the sort of right quantity of fruit and fruit juice intake?
This is also very commonly asked questions from all the patients. And fruits, specifically apple, guava, watermelon, half piece of a melon, strawberries, papaya, they all are good sources, and they should be taken regularly around 2 to 3 times per day. And because all these fruits have low glycemic index, so they are good for diabetes patients. And fruits such as mango, banana, chiku, they should be avoided because they have high calories in them, and they should be avoided in their routine diet. And if patients are well controlled with their sugars, then they can probably take few pieces of bananas or mangoes or chiku, but provided they should avoid other fruits which they were taking routinely in their daily routine diet. And the next question you asked was on fruit juices. So basically, fruit juices have a high sugar content, and specifically fructose sugar, which is a type of a sugar, and they do have less fiber content. So and all the studies have shown that fruit juices have a increased sugar content as well. So basically, and there's for example, if we take a fruit such as orange, so orange has a glycemic index of around 40 to 60, whereas orange juice has a glycemic index of around 90 to 100. So it tells us that fruit juices have a high glycemic index as compared to normal fruits which we take it. And fruit juices are specifically helpful in patients who have an episode of hypoglycemia. Hypoglycemia is nothing but low glucose levels. So if a patient with hypoglycemia have a glass or a half glass of fruit juice, then it will help in raising the blood sugars instantly, and they can probably increase the sugars very quickly in their blood. So they are only recommended in patients who are suffering from recurrent hypoglycemia, or a patient who is on drugs or insulin and suffers from hypoglycemia.
Most people with hypertension may also suffer from diabetes. And in order to manage hypertension, patients are advised to follow a DASH diet. What is this diet, and is it safe for people with diabetes as well?
So basically, the DASH diet is it's called DASH because it is dietary advice to stop hypertension. So it was developed to stop and control hypertension better. So we know that for any hypertensive patient, reducing salt is a well-known fact in the diet to less than 3 grams, so 2.5 to be correct. So usually we include a good amount of vegetables, legumes, fruits, and reduce the fat intake in the DASH diet. So there is something called a low sodium DASH diet, which through studies, which they have found that for hypertensive patients, the control was very much better when you take low sodium along with recommended fruits, vegetables, pulses, grams, and also low saturated fat, that is containing meat, red meat, and so on. So if you take such diet, you are supposed to get a good control of hypertension. So what, from your question, you actually asked, is it good for diabetes patients also? Yes, definitely it is good, and it is proven through studies that if you take a DASH diet, it would also control your diabetes better. And to add it more, actually it is said that even for gestation diabetes, for patients who are pregnant and have diabetes, have got a good control to DASH diet. And it doesn't stop with that. The goodness extends to also prevent diabetes for patients who are having hypertension. We know that among 2 out of 3 patients with diabetes have hypertension. So if a patient is hypertensive and has got a borderline control of sugar, if he is put on a DASH diet, it doesn't only just control his hypertension, but also it prevents from him landing up in diabetes. So it's as important as that. Yeah.
What about carbohydrates? Are carbohydrates a big no-no for diabetes patients? Are all carbohydrates to be eliminated completely? What are some of the carbohydrates that one could perhaps still include?
This is an assumption which is in everybody's minds, that only avoiding carbohydrates in your diet can control your sugars or maybe cure your diabetes. But that's not true. And a patient who is completely on a probably a fat or a meat diet still will have carbohydrates produced in their bodies. So basically we asked what all the next question which you asked was what all carbohydrates, what type of carbohydrates can be taken up. So basically carbohydrates are divided into 3 main categories, which include starch, fiber and simple sugars. So a diet which is rich in fiber is always helpful for patients with diabetes, and we also recommend a term which is called as glycemic index. So foods which contain low glycemic index are always recommended and should be taken in more amount in their routine diet. So low glycemic index foods includes all the green leafy vegetables such as carrots, broccoli, spinach. They all are good sources of they have low glycemic index, and patients who are on foods which are rich in which have high glycemic index should be replaced with foods which have low glycemic index. So what does glycemic index means is basically it's the ability of the food to raise the blood sugars. So if a patient has food which contains low glycemic index is always helpful, and it should be taken routinely and in more amount in patients with diabetes.
All right. Well, on that note, we're going to slip into a very short break, but we have a lot more questions lined up and the doctors will continue to be with us. So stay tuned. Welcome back. Our panel of expert doctors continues to be live with us. Dr. Syed, if I can come back to you at the moment, it is said that, monosaturated fats such as olive oil can actually be good for your heart. Is that correct? What type of oil is most beneficial for use by people with existing heart disease?
Yeah. As you said in the beginning of our program, that concern towards the health and diet has improved, especially during the COVID, and people with a lot of stress have now started studying a lot. At the same time, misconceptions have also developed a lot. So actually the MUFA, the monounsaturated fatty acids, they are mostly present in animal sources, basically the red meat and others. Very little source comes from the plant, especially the olive oil. This olive oil, the MUFA from olive oil is, through studies, it has proven that it is very good for the heart health. But on the other hand, the sources from animals like red meat, MUFA doesn't actually help to reduce the heart burden or the disease burden as such. So which oil can we prefer to use for our daily cooking? So naturally, if you can use olive oil if it is available and if it is affordable, it is good as far as MUFA is concerned. but the better one will be, the best one will be PUFA, which is polyunsaturated fatty acids, which is richly present in the sunflower oil, safflower oil and others. So it is basically the N6 omega fatty acids, so which is very good for heart health. As you asked about the antioxidants, so they actually play a very good role as an antioxidant, and they also reduce the bad cholesterol, which is the low density lipoprotein, LDL, and the triglycerides. At the same time, they increase the good cholesterol. So if you ask me the final verdict, which one to use for daily cooking, it should be PUFA, maybe sunflower or safflower oil.
Dr. Jain, you know, the other important question here is what really is glycemic index? Now, you've used this terminology earlier on the show as well. We've all heard this terminology, but can you explain what this glycemic index tag means for fruits and how for foods, and how relevant is it for diet planning when it comes to a person who has diabetes?
So glycemic index is nothing but the measure of the level of sugars which will rise after intake of certain fruit or a food. So if a food basically raises your blood sugars to a higher limit, then it is a high glycemic index food, and if it is low and it is broken down slowly, then it is a low glycemic index food. So when we consume carbohydrates in any form and it is broken down into simple sugars, which is required, which is converted into glucose, which we call it, and it is required by all the cells of our body, which they utilize for the energy purpose. So we recommend all the diabetic patients to swap from the high glycemic index food to the low glycemic index food. So low glycemic index foods includes breads such as whole grain or multigrain flour can be used in breads, and breakfast which should contain of oats, and fruits such as apple, guava or strawberries and apricot. They are all good in diabetic patients. And vegetables, specifically broccoli, carrots, they are all good sources of low glycemic index foods. So what is its relevance in diabetes? It's basically, it could help in reducing the blood sugars, and it will definitely prevent in progression of disease and prevent the complications as well.
All right. Well, thank you both doctors so very much for joining us on this edition of the show. You've answered some very, very important questions for our viewers. Thank you very much.
Thank you.